Recent research into running injuries is revealing a more nuanced picture of how sex and gender influence risk, not just in terms of frequency, but in the type, timing, and underlying causes of injuries. While men and women both suffer from common overuse injuries like shin splints, IT band syndrome, and stress fractures, the patterns in how these injuries develop and why can differ in meaningful ways. These differences aren't just anatomical, they also reflect hormonal fluctuations, biomechanics, energy availability, and training responses under physical stress. As running science evolves, understanding these distinctions is becoming essential for personalized injury prevention. One of the most well-documented gender differences involves bone stress injuries, which are significantly more prevalent among female runners. While high-impact forces and repetitive loading play a role in all stress fractures, women are more likely to experience these injuries when low energy availability, often due to underfueling, is present. This is part of what was formerly known as the female athlete triad, now more broadly understood as RED-S, relative energy deficiency in sport, a condition that affects both men and women but tends to have more visible effects in females. Disrupted menstrual cycles, low bone mineral density, and impaired recovery combine to weaken skeletal structures under load, making even moderate training intensities hazardous without sufficient caloric intake and recovery. Hormonal fluctuations across the menstrual cycle can also influence injury susceptibility. For instance, research suggests that joint laxity may increase during the ovulatory phase due to a spike in estrogen, possibly contributing to a greater risk of ligament-related injuries, such as ankle sprains or knee instability. While this doesn't mean women are inherently fragile, it does point to the need for training and recovery strategies that are responsive to the physiological shifts that occur throughout the month, something most training plans still fail to address. Biomechanical differences may also influence loading patterns and injury profiles. Women, on average, have a wider pelvis and greater Q angle at the knee, which can alter force distribution through the lower extremities during running. This may partly explain the higher incidence of patellofemoral pain syndrome and hip-related injuries among female runners. Meanwhile, male runners, who often exhibit stiffer running mechanics and higher peak impact forces, may be more prone to Achilles tendinopathy or calf strains, particularly under high-volume or speed-based training. Stress responses and pain perception may further shape injury risk and recovery behaviors. Some studies suggest that female runners are more likely to report and address early signs of pain, while males may delay intervention until injuries become more severe. These cultural and psychological differences can influence how injuries are managed or ignored, potentially affecting outcomes and downtime. Notably, these patterns don't suggest that one gender is inherently more injury-prone than the other. Instead, they highlight the importance of recognizing different pathways to injury. A training load that is safe for one runner may be risky for another depending on hormonal state, nutritional status, biomechanics, and even past injury history. The more we understand these interactions, the better we can tailor training plans to respect biological rhythms and physical variability, not just between athletes, but within the same athlete over time. Moving forward, injury prevention strategies must go beyond generic advice. Female runners may benefit from energy availability screening, hormonal cycle tracking, and strength work aimed at pelvic and core stability. Male runners may need more attention to calf resilience, tendon recovery, and strategies to recognize fatigue-driven compensations. Across the board, integrating strength training, mobility work, and personalized recovery windows can help mitigate many of the most common risks. Ultimately, better injury prevention isn't about comparing men and women. It's about understanding how stress affects the body through different lenses and designing smarter, more adaptive approaches. Recognizing gender-specific patterns is a step toward more inclusive and effective training science, where every runner's body is better understood and better protected.